assuming Christian Marcel, what's your name?
Dakuan.
Nice to meet you. Today we're going to be doing some lumbar spine and lower extremities orthopedic tests. If anything I do hurt, please let me know, and if you have any questions, feel free to ask.
Gotcha.
Can we begin?
Yes.
Okay, first test we're going to do is minor sign, or the solo hold for low back. So what I'm going to have you do is just in your seated position, just stand straight up for me. Thank you. And positive would be the inability for the patient to stand up, or he needs assistance going from the seated to a standing position. And this would indicate sciatica, lumbosacral, or sacroiliac joint lesions. Next test we're going to do is called Belts test. And so what I'm going to do is have my patient face towards this way. And may I contact your PSIS and
Yes.
PSS?
Yes.
So I'm going to stabilize you here, and I'm going to ask you to bend down and touch your toes. Good. And for the second test, I'm going to stand to the side of you, hip to your backside, and I'm going to stabilize your iliac crest.
Okay.
And I'm going to have you do the same movement. You can go. Good. And the positive would be low back pain. If he had, the indicators would be if he had pain during both tests, there would be a lumbar spine problem. And if he had pain during only the first test where he bent down and touched his toes, there would be a sacroiliac problem. We're going to be doing lumbar spine assessments. The first one is the Valsalva's maneuver. So I'm going to have you clench your hands, take a deep breath in, and hold and really push, like you're taking a ball. Good. And the positive would be radiating pain from site of this lesion. And the indications would be nerve root entrapment by this lesion. So the next test we're going to do is called the heel walk test. So I'm going to have my patient stand while I'm standing. I'm going to ask him to go on his heels and just take a couple steps forward. That's it. Thank you. And the positive would be the inability to perform the test. And this will indicate an L4 disc lesion while applying pressure on the L5 nerve root. The next test we're going to do is toe walk. So what I'm going to have my patient do is stand here. And in a second, I'm going to actually stand on your toes and just take a couple steps from you. That's it. Thank you. And the positives is the inability to perform the test. And the indications would be an L5 disc lesion with pressure on the S1 nerve root. So the next test we're going to do is chem test. So I will have my patient sit down as he is now. I'll have you cross your arms. Put your arms on the chest. I'm going to laterally flex you this way, and I'm going to support on your PSIS, and I'm going to rotate you. Good. And I'm going to do the same thing on the other side. So laterally flex you, support here, and reach around. And the positives would be radicular pain or local pain. If there was pain when he was going towards the way of the lesion, then it would be a lateral disc protrusion. And if he was going away if he had pain going away from the way of lesion, then it would be a medial disc protrusion. And if there was local pain, there would be facet capsulitis or lumbar spasms. Now we're going to be performing a sciatic nerve test. The first test we're going to do is straight leg raise. So I have my patient lay down. I'm going to contact your leg. I'm just going to raise it straight up. Go straight up here. Thank you. And when we do the straight leg raise, we'll raise it up until a point of pain or from 35 to 90 degrees. Positives is radiating pain or dull pain in the posterior thigh. This would indicate sciatic radiculopathy or tight hamstrings. When raising the leg 35 to 70 degrees, it can be possible discogenic sciatic radiculopathy. And when it's above 70 degrees, it'll be tight hamstring. The next test is Braga's test. Braga's test will usually be done after, if there's no positive for straight leg raise. I'm going to raise your leg to 90 degrees. All right. So you bring the leg up, and I'm going to bring it down 15 degrees. And I'm just going to dorsiflex your foot. All right. The positive would be radiating pain or dull pain in the posterior thigh, and this would indicate sciatic radiculopathy. Now we're going to do Sicard's test. I'm going to raise your leg up 90 degrees. All right. We're going to bring it down 15, and I'm going to dorsiflex your big toe. All right. Good. And the positive is radiating or dull pain in the posterior thigh. The indicators would be sciatic radiculopathy. Now we're going to do Linder's test. Linder's test is usually done done when there's extreme cases of sciatic radiculopathy, or if the patient cannot do a straight leg raise. I'm gonna just have you have your hands with your arms, so I'm gonna raise your hand. Good. And the positives will be radiating pain going down the posterior thigh, and this will be indicating of sciatic radiculopathy. The next test we're going to do is Turin-sign, and this test is also done when there's extreme cases of sciatic radiculopathy. So I'm going to have the patient just lay as he is, and I'm going to flex your big toe. Dorsiflex your big toe. Good. And the positive will be pain in the posterior thigh, and this will indicate sciatic radiculopathy. I'm going to do Bonnet's test. So I'm going to raise your leg. I'm going to medially rotate it, and I'm going to bring it towards the other leg, and then I'm going to lift it towards you. Good. A positive would be radiating pain in the posterior leg or thigh. The indicators would be sciatic radiculopathy or piriformis syndrome, and we'll know it's piriformis syndrome if there's immediate pain while doing the test. So now we're going to be doing Wells leg raise test. The patient has left sciatic radiculopathy or left sciatic pain, so we're going to raise the right leg. Just going to raise it up. And the positives would be increased pain on the affected leg or decreased pain on the affected leg. If there's increased pain on the affected leg, then there'll be a medial disc bulge. If there's decrease in the affected leg, then there will be a lateral disc bulge. So now we're going to do the femoral nerve traction test. I'll have my patient set up as he is. I will ask him to tuck his chin to his chest for me. I'm going to stabilize at your hip. I'm going to flex your knee, and I'm going to extend you at the hip. Good. And the positive would be pain in the anterior thigh, and this will indicate entrapment of lumbar roots L2, L3, and L4. I'm going to do Nell's foot sign. This is my reflex hammer. My reflex hammer feels like this. Is that fine?
Yeah.
Okay. Now I'm going to contact your ankle. I'm going to contact your medial plantar nerve.
Right.
And the positive would be paresthesia on the bottom of the foot. This will indicate tarsal tunnel syndrome. So now we're going to do Morton's test. So I'm just going to squeeze your foot.
All right.
Positive would be pain between the metatarsals, and this will indicate metatarsalgia or neuroma in the third or fourth metatarsal.